A child's early years lays the foundation for future learning. However, if they have an undiagnosed developmental delay, this can severely affect their educational progress. The key is therefore early detection. The Ministry of Education, Training and Employment is leading the charge to ensure that this happens.
Well, the ministry is focusing very strategically on developmental disabilities, and particularly in the early years programs and early preschool age children. What we know about developmental disabilities, whether they're global developmental disabilities, which affect all areas of development, or what we might call pervasive developmental disabilities, which are more like autism spectrum disorder, that those types of concerns as you go into adulthood are our most expensive healthcare items and our most expensive educational items in terms of government, and that's why we're quite concerned that we address those early on.
Children develop differently as they grow, and recognizing developmental delays can be difficult both for parents and professionals alike. Early Interventions Anna Cartwright lists a few of the typical activities which children should master as they grow.
In a 6-month-old, there's a lot of development they've made since they were just born. By now, they should have developed the ability to, say, lie on their tummy. They should be able to prop themselves up, reach for a toy, and that's really nice when they can do that, because then they can start to develop hand skills. By 1 year, they are into everything. They start to enjoy playing with objects, such as packaging of objects. They prefer that than the actual toys often, so you can see they're starting to explore things. By then, they're starting to stand up. They should be able to pull to standing. By 2, they are into everything. They're jumping, they're hopping, they're running, they're climbing into everything, over everything. So you should have a very active child by the time they're 2, because they're exploring their gross motor skills. They've got a lot of stability and balance. They're running, which is really nice for them as well. By the time they're 4, they're a lot more independent with their gross motor skills. For their fine motor skills, they should be able to draw a line across, up, and around. So that's the beginning of their pencil skills, and that's a really important milestone for them. As occupational therapists, we're not so interested in what age they get the skills. There's a huge variation in what age normal children acquire these skills, so we allow a lot of variation. So red flags for me is if a child is overly floppy, if a child is very high tone, which means they're quite stiff to move. If they're not bringing their eyes in together, that's really important. Say they're just using one hand when they're only little, when they're 1, they shouldn't have dominance by the time they're 1. That comes in later. So we should still be seeing 2 hands being used when they're 1.
However, parents who have concerns about their child's progress have several local options for evaluation and treatment.
We can do a lot of treatment, whether it's occupational therapy, physical therapy. If it's social and emotional, we can do work with behavior specialists and counselors. So there's a variety of services that can be provided that will actually remediate the problems before a child gets too far into their education or become an adult.
The first stop for a parent who's concerned about their child's development should always be their pediatrician. The pediatrician can then refer on to the physical therapy department at the hospital. They can also refer to the early intervention program, where occupational therapists can do an assessment to determine if the child is having difficulties. Or parents can also go to private physical therapists for advice and treatment.
The service at the Wellness Center that we offer in terms of physical developmental delays would be occupational therapy. And occupational therapy is a type of therapy that looks at addressing issues of coordination and balance, fine and gross motor coordination, and typically a child who's maybe late to walk or late to crawl. You might want to look into, is this an issue of gross motor? Are they able to, where is balance and coordination, how their muscles are integrating, how they're using their muscles. And an occupational therapist in adult populations does just that. They help people to regain occupational skills. So if an adult, for example, had a stroke or some kind of trauma, an occupational therapist might work with them to develop skills to dress themselves or to feed themselves or to go shopping for themselves. And in childhood, the occupation of childhood is to play and to interact with other children. And so occupational therapy for children is a lot making sure that they have the ability, the physical ability to play, to stack blocks, to jump, to run, to swing, to climb. And so an occupational therapist could be working on those types of skills with a child who has some physical delay.
No one knows your child better than you do, so be observant and educate yourself about developmental milestones using any of the websites listed on your screen. Also, remember to join us next time when we'll take a look at some of the communication milestones your child should achieve as they grow.